Today we're going to look at the blood flow of the blood through the heart. So you're going to need this sheet. And how we're going to do these notes is we are going to travel through the heart, starting with how the blood returns to your heart from the body. And then each time you see in your notes, or each time you see your note sheet on the board, make sure you write the label in the inner box for each structure. So for example, whenever you see this, it's going to help you know which label we're going to first, and you're going to write that in here. So the structure goes here, and then what does that structure do goes on this side. And then when we're completely finished, what you'll do is cut along the dotted lines and then fold along these vertical lines so that, here's a finished one, you can use it as a study sheet and you'll be able to flip it and test and quiz yourself over it. So in order to, because those little boxes are not very big, in order to have room, you can use some abbreviations. RA for right atrium, RV for right ventricle, LA and LV for left atrium and ventricle, and then SVC stands for superior vena cava, and IVC is inferior vena cava. Now, when we talk about atrium, we are talking about the top chamber. So atria in this picture, here's an atria and here's the atria on this side. So it is the top two chambers are the right and left. Now remember, it's that person, that heart, that the person's right and left, just like we've done the whole year. So this is actually your right atrium. This would be your left atrium. And then the ventricles are the lower two chambers. The ventricles are typically a lot lower or a lot larger. And they're more muscular because they have to pump the blood further than just from one chamber to another. They pump it to the body or to the lungs. So we have, this is the right ventricle, left ventricle. We're going to see the valves, what their names are. The valves are going to be what, so right here's a valve, right here's a valve. It helps prevent the backflow of blood, allows for one direction movement through the heart. These valves are connected, these cuspid valves, especially tricuspid and bicuspid valves here in the ventricle going from the atrium, both atrium into the ventricle. You can see they have like this webbing, it looks like, to help connect them to the wall of the ventricle. Those are called chordae tendineae. We're going to see that also. Okay, so here's our first two, superior vena cava and inferior vena cava. Remember to write your labels here. If you need to pause it to do that, go for it. So our superior vena cava is up here, inferior vena cava is down here. So the superior vena cava brings the blood from the upper body to the right atrium. So if you can see on this picture, here's our superior vena cava. You can see eventually branches. They come into this one vessel, but it's bringing all the blood from the upper body to the right atrium. The inferior vena cava does the same, but just for the lower body. So here's our lower body, vena cava, inferior vena cava coming to the right atrium. So the right atrium is collecting that deoxygenated blood, which is why it is blue. You can also color coordinate your notes with blue and red. We're going to switch when we get to oxygenated blood. Okay, next. So now we're in the right atrium. The right atrium will pump blood to the right ventricle. So that's its function, is to collect the blood from the body and pump it to the right ventricle. Next is the tricuspid valve. So the tricuspid valve opens to pass the blood from the right atria to the right ventricle. So it is the valve that is separating the right atrium to the right ventricle. The blood passes through here. It's called tricuspid because it actually has three cusps, three flaps to it, and each of those valves again are attached to some papillary muscles by tendons. Those tendons are called chordae tendineae. Okay, so now the blood is in the right ventricle. The right ventricle will pump blood to the lungs. So it comes up and it's going to push the blood. The tricuspid valve will close. It's going to pump through this to the lungs through the pulmonary valve, sometimes called the pulmonary semilunar valve. So the pulmonary semilunar valve opens to pass the blood from the right ventricle to the pulmonary arteries here. So you can see that, look at the shape from the tricuspid valve, that it kind of points down, allowing the blood to come easily here. When the ventricle starts to contract, that shuts these valves, it pushes against this side of the valve, but this valve is able to open into the pulmonary arteries, which is going to be our next one, pulmonary arteries. So this part is sometimes called the pulmonary branch, and then it splits into right and left pulmonary arteries. So I have, this would be my left pulmonary artery, right pulmonary artery. So the pulmonary arteries will carry the blood from the right ventricle to the lungs, where it will pick up some oxygen. After it exits the lungs, after it has been oxygenated, you'll notice that we have a red font now. They come back through the pulmonary veins because the blood is coming back to the heart. So the pulmonary veins, again, we have right and left. So this would be the left pulmonary veins, and then you just can't see it on this picture, but you'd have right pulmonary veins as well. They carry the blood from the lungs to the left atria. So it's going to collect here in the left atria, which will go to the left, or right here, I guess left atrium is our next one, which will pump the blood to the left ventricle. Left atria pumps the blood to the left ventricle. It has to go through the bicuspid valve. So bicuspid means two cusp. So it is just a two cusp valve. Sometimes the bicuspid valve is also called the mitral valve. So the bicuspid valve opens when the atrium contracts, pushes the blood through the bicuspid valve into the left ventricle. Then the blood would be at the left ventricle. The left ventricle, it is the thickest chamber. Look at the myocardium around the left ventricle. The reason why is it has to pump that blood all throughout the body. So it has to give the blood the highest pressure. The right atria only pumps the blood to the lungs, which is a lot closer. They're right next to the heart, so it doesn't have to have as much pressure to get to the lungs. The left ventricle has to have a lot more force behind it to get the blood to all your other body tissues. In order to get to the body, it has to go through the aortic semilunar valve. So the aortic semilunar valve, right here, it pushes through, it opens for the left ventricle into the aorta. So aorta is our next part. You can see it is this vessel that comes up and it will curve. It has branches off going to the upper part of your body, but it curves down and brings a lot of that blood down to your lower part of the body. It is the largest artery. It's about the size of your thumb. So if you look at your thumb, it's about that size. A lot of blood can pass through there. It has to have very thick muscular walls to withstand all that pressure because there's a lot of pressure coming out of the heart, and it has to go in a U. So it's withstanding a lot of pressure. If you have ever heard of an aortic aneurysm, that can be fatal because it means that there's a bulge, and that bulge can burst on the aorta, and it can cause a lot of major bleeding if you don't get it caught right away. It carries the blood from the left ventricle to the rest of the body. And another part of the heart is right here down the middle, is called the septum, sometimes called the interventricular, meaning between the ventricles, their interventricular septum. It's a muscular separation, but it helps with contraction. And we're going to see when we get to the conduction system that we have some nerve fibers that help with the contraction of the heart that run through the septum. There's also an interatrial septum, but it's very narrow, but it's up here between the left and right atrium. So it separates the right and left sides of the heart. So there's the interventricular and interatrial septum. Something that your note sheet, so that should have filled out the sheet, and then you can go ahead and cut on the large dotted lines, the horizontal dotted lines, fold on the vertical folded lines, and you have a nice little study guide for yourself. but it did not go through coronary circulation. So coronary circulation is the blood flow that goes to the heart itself, because your heart is going to require a lot of oxygen, a lot of nutrients to continually contract. It gets some of the first blood flow out of the aorta. So you'll notice right here, these are the arteries. Look where those arteries exit, right at the base of the aorta. So right where the blood comes out of the left ventricle to the aorta, it is going to exit and give the oxygen and metabolic needs to the heart muscle itself. So we have right and left coronary arteries. It just exits the aorta just superior to the point where the aorta exits the heart. And then we have cardiac veins. So here's the cardiac veins. They are going to drain all that deoxygenated blood into what's called the coronary sinus. It's on the kind of the back side, the posterior side of the heart, but it empties it into the right atrium. So I think on the next, we'll be able to see on the next slide, because this sheet, it doesn't show the coronary sinus on it, because there should be 3 openings into the right atrium using that coronary circulation. If you have any relative or have heard of anyone that's had a heart attack, the medical term for that is a myocardial infarction. It is a blood clot or some sort of obstruction. It can just be from blockage, not from blood clot, but maybe if you have plaque or high cholesterol, like you have a buildup in the vessel. It can also completely obstruct a coronary artery, which would kill part of the heart. So when they do a coronary bypass, what they're doing is trying to bypass. They're going to take like maybe from up here, and they're going to bypass that blocked part and come down here. So the blood has an alternate route around that blocked area. So that's why if you can have a double, triple, quadruple, I don't know if you can have a 5, I don't know. Quadruple bypass, that is what they're doing. They're bypassing the blocked area on the coronary circulation, because that the heart muscle itself can die with lack of oxygen. So after a heart attack, a lot of times if you do have muscle that actually died, you have a lot less ability for contracting and getting blood to the bodies and organs that it needs. So here's a look at the external anatomy. We can see here's a superior and inferior vena cava. Here you can see that right pulmonary vein and the left pulmonary vein. Here's our pulmonary trunk, and then it branches into the left and right arteries, pulmonary arteries. You do not have to know the name of the different coronary arteries, but just that there's the coronary arteries and coronary veins. You do need to know the coronary sulcus, which here you can see the opening on the internal anatomy. Right here is the opening for that coronary sulcus, and here's the openings for the right and the inferior and superior vena cavas. You can also see really well, here's those papillary muscles where the chordae tendineae, they're connecting those the bicuspid and tricuspid valves to the wall of the ventricle. Let's see what else we see here. I think that's it. So the right side of the heart forces blood to flow to the lungs. The blood vessels that supply blood to the heart tissue are the coronary arteries. Which of the valves is found between the right atrium and the right ventricle? The tricuspid valve. Which of these statements concerning the normal pathway of blood flow is not correct? Pulmonary veins, they go to the left atrium instead of the right atrium.